Hi everyone, this is Dr. Kirthi Theja Bommakanti, Senior Consultant Neurologist at Chaitra's Neurology and Spine Clinic ECL branch. We celebrate November 17th as World Epilepsy Day. So it is very much useful for each and every citizen to have some important and basic information about epilepsy. So epilepsy in layman language, it is called fits. So nowadays, the incidence and prevalence of epilepsy is increasing. So it is very much useful for everyone, each and everyone, to have some basic and necessary information regarding epilepsy. So what is epilepsy? So epilepsy is also called fits. If a person gets single time fit, that is called seizure. And if the person gets multiple time fits, then that is called epilepsy. Okay. So when a patient gets epilepsy, so how do you identify that the patient had got a fit, seizure, or epilepsy? So epilepsy or a seizure can manifest in various ways, but the most common type is called generalized tonic-clonic seizures, where a patient can have sudden loss of consciousness associated with rapid vigorous shaping of hands and legs with tongue bite, frothing, uprolling of eyes, can pass sometimes urine involuntary or can also pass stools, followed by loss of consciousness. So this is a very classic presentation of generalized tonic-clonic seizures. So if the person has been diagnosed as having these seizures, the thing is that generally he should immediately go to a nearest neurologist. Once he goes to nearest neurologist, we take a detailed history regarding if the patient was having the previous attack or the first time attack, or the patient has any childhood history or family history. And first and foremost thing what we do is, once the patient comes to the emergency or to the clinic with a history of seizure or an epilepsy, we first rule out whether that is a true seizure or a pseudo seizure. Once we diagnose the patient is having the true seizure, we label it as a seizure activity or epilepsy syndrome. Once we identify the patient is having epilepsy syndrome, as per the International League of Epilepsy, we classify whether the patient fits into a different category of epilepsy. Once we diagnose the patient is having true seizure or epilepsy and we categorized into the epileptic syndrome, then now comes an important role. We have to evaluate a patient with epilepsy. So we take detailed metabolic profile and then we will rule out structural brain imaging by doing MRI epilepsy protocol or CT brain, and then we do the functional analysis of the brain with EEG. Once we do these basic investigations for epilepsy, once we diagnose the patient is having a true seizures, now before going to the treatment, we tailor the treatment based on the age, the sex, the weight of the patient. And then once we confirm all these things, then we start the treatment with anti-seizure medications. So if in general, if in the public, if you see a patient getting a seizure or an epilepsy, we shouldn't panic. What is the first aid we need to do? If the patient gets a seizure, no need to panic. Just make the patient lie down on the floor and turn him to the left lateral position and keep his arm below the head. And then don't keep any keys or any object in the hands, or don't keep anything in the mouth. Just if he is having vigorous seizure activity, just you need to hold his hand and check for the time of onset of seizures, because generally if the seizure is subsiding within the 5 minutes, you need not panic. If the seizure is progressing more than 5 minutes, then it indicates the patient is going into a status. Then you need to immediately hurry him to the nearest hospital for getting emergency drugs. Okay. And the thing is that when a person gets a seizure activity, you should keep him in the safest place, so that when he gets a seizure activity, he won't get trauma or injury to the objects which are lying close to him. So it is very much important to be calm, and you should call for an emergency and go to the nearest hospital. So if the patient gets an epilepsy, the causes can be hereditary, or it can be some of the epileptic syndromes will run in the family, or even sometimes it can be acquired. Acquired can be due to the infections of the brain or a trauma or injury to the brain. It can be due to the stroke, or it can be due to the metabolic derangement. There are, however, some other causes which are very rare. So if the patient gets an epilepsy, you need to identify that is an epilepsy. There shouldn't be any social stigma. You should go to the nearest neurologist and you should discuss with him about the problem and then get treated. Thank you.